Hello, my name is Chris Davis, and I am here at Good Shepherd Clinic. It's located at Our Savior's Lutheran Church, 1020 State Street in Spearfish. I am an eligibility volunteer during the clinic hours, and then I am also a board member and the PR marketing chair. And welcome to the clinic. And I just want to give an overview about what we do here. Our Savior's Lutheran Church started Good Shepherd Clinic as an outreach ministry in 2009, and so we are now in our 13th year of ministry. And what we do is provide medical care to those without insurance and that meet our financial guidelines, and then we also have emergency dental care. Our clinic is open on Monday evenings. Doors open at 6 o'clock. Patients come to the church, and they are welcomed into the church and meet with a variety of volunteers to get the care that they need. And what I would like to do is just take you on a tour of how we've adapted during COVID to providing our services and ministering to people. So we're in the fellowship hall at Our Savior's Lutheran Church. When our patients come, they are greeted by volunteers here at the door who will give them a basket. Before COVID, we were able to meet face-to-face with everybody and do in-person interviews. We were closed from mid-March until mid-August and figuring how to adapt and watching COVID numbers. And so instead of being able to do in-person visits, we now conduct all our visits by telephone. So as patients come in, they are greeted and they are assigned a number and given some paperwork about our clinic, other resources in the clinic, but they're also given a telephone. And so everybody will have their own unique phone number for the evening, which our volunteers will call to conduct our visits. During pre-COVID, we were able to invite everybody into the church fellowship hall where they were able to sit around tables, receive some food, such as beverages, fruit and vegetables, and sandwiches, and just have a chance to relax and visit while they were waiting for their appointments. We are a walk-in clinic, but we do everything kind of a first-come, first-served basis. So while people were waiting to be seen by the next volunteer or the healthcare providers, they were able to have a chance to visit with other people that were here. But during COVID, what we've had to do is change the sanctuary into our waiting area. So we have numbers assigned, and again, as I mentioned earlier, everybody is assigned a number, and then they sit according to their seats, wait there until they are called on their telephone for that next interview that they'll have. We're now in the fellowship hall, and this is where all our volunteers will be stationed during the evening. During each clinic, we will have 2 eligibility volunteers, and they are the first volunteers that will interview our patients, and just verifying address, phone numbers, contact information, and then making sure that people don't have insurance and asking about the monthly income to make sure people meet our financial guidelines. And our guidelines are based on 200% of the federal poverty level, so we adjust those each year. And we get the monthly income from people and then how many people are supported through that income. And because we're doing everything by phones rather than people moving, the patients moving between volunteers, we now move the chart. So from eligibility, the charts will then go to our nursing volunteers. And again, pre-COVID, the nurses were able to check weight, height, blood pressure, pulse, different things like that. Now they're doing the telephone conversations and asking the reason why the person is here at the clinic, and then also getting other health information such as medications and other issues. The chart then moves to be ready for our healthcare providers. And we have about 15 healthcare providers that rotate through 2 per night. And those are medical doctors, nurse practitioners, and physician's assistants. And so we really appreciate that. And one important thing about our clinic is all volunteers are volunteers. We have no paid staff whatsoever. So any donations that we receive or grants go right back into the clinic for clinic supplies, immunizations, prescriptions, and then as we prepared to reopen up during COVID, there were a lot of PPE, supplies that we needed to buy, extra masks, the telephones, and then some of the other protective barriers that are in place all around town. Each evening during the clinic, we do have 2 nurse volunteers who are the ones that, again, are collecting that health information for each person that visits us. But we also have a head nurse that coordinates what happens after the healthcare providers see them. So if somebody is here and then needs to be referred out for lab work, x-rays, maybe over to another physician, the head nurse from this computer will coordinate different things. And then I, as an eligibility volunteer, may need to visit with the patient because we give the patient some information about Monument Health Financial Assistance Program. So there may be some costs associated with that extra work that needs to be done, extra medical care, that Good Shepherd Clinic will not be responsible for, but we assist the patient with going through that paperwork so they can get their care taken care of. Back here is where our healthcare providers are going to be, and normally, again, pre-COVID, we did have 2 rooms that were able to be made into exam rooms. So the healthcare provider was actually able to see the patient. Now everything is done by phone, but if the physician or the other healthcare provider needs to see the patient, maybe checking out a rash or a spot or something, they are able to go back into the sanctuary and visit. We also have a pharmacist here on Monday nights that can help refill prescriptions or write new prescriptions. We work with 3 local pharmacies that give us a discounted formulary, so we also pay for prescriptions that people need. And our big thing, too, is we're also providing immunizations. We're not doing the COVID immunizations, but flu, tetanus, HPV, shingles. We're really encouraging people to stay healthy that way through the immunizations. And again, that's another service that we provide that's paid for. During each clinic, we probably have about 15 volunteers that are here. So the volunteers that meet people at the front door and seat them. We've got eligibility, a number of nurses that are here. We've got our healthcare providers. And then we also have 2 people that work here at medical records. So as patients come in and they give their names, we find out if they are returning patients, where we already have a chart made up for them and pull that we work with during the evening. If they are new patients, then a chart is started for them. And again, we just keep that on record. And then at the end of the evening, our medical records people enter information into the computer, and that's how we keep our statistics. So since we opened up our doors in 2009, we've had over 6,000 patient visits. We've had probably 12,000 plus prescriptions that we filled, a couple hundred immunizations that we've given. So that's all very important. And again, none of that could happen without support of Spearfish and surrounding communities through private donations and then grants that are written for us. Good Shepherd Clinic was very honored to receive an inaugural Community Impact Award during the Spearfish Area Chamber of Commerce banquet on April 22nd. So again, we appreciate the support of the community. We couldn't do it without the support, but especially the vision of Our Savior's Lutheran Church for beginning the clinic and those founding visitors. We hope in the near future and within the next couple months that we can open up as we were used to pre-COVID, and then we are also working on reopening our dental program. So hopefully within the next couple months during the summer and by fall, we'll be back up to what we are used to, welcoming people back in and serving them. And if anybody's interested in more information, our website is www.goodshepherdclinicspearfish.com. And on there, we have a volunteer application if anybody's interested in volunteering with the clinic. There's also a way to donate to the clinic. So a number of ways to participate and support our ministry.